VCHRI is the largest hospital-based research institute in Western Canada. VCHRI is really at the heart of healthcare research in BC. We have a distinct advantage in the sense that we operate at the intersection between UBC and Vancouver Coastal Health. By working so closely with these organizations, we're able to translate all the new discoveries and put them into clinical solutions in our patient care.
One of the things that's important to recognize is that we're actually leading very ambitious initiatives that were multi-institutional, multinational, really speaks to the leadership and really high level of research quality that is done here. Having VCHRI and ICOR positioned here at the hospital really does allow us to have that close connection with the problems that are really relevant to our patient population.
So over the past 25 years, we've grown a very successful model. Team science, multidisciplinary, but with a disease focus that allows you to take discovery all the way into the clinic and beyond. So here in Vancouver, we have an excellent ecosystem that allows us to attract the resources, the people, the funding, and ultimately not just to improve healthcare, but ultimately create new companies, new jobs that contribute to economic growth.
All patient care improvements really rest on somebody researching a problem in a proper scientific way. And that goes from molecular cellular to a clinical trial, but also just looking at healthcare delivery and policies, making the policies based on the best evidence. VCHRI, by enabling those foundational researchers and clinician scientists to be co-located in the same building, really facilitated that interaction. Our connection with the community through this center is that every patient who walks through the door knows that both benchtop research and clinical trials being done that give them hope.
Community-engaged research is really important because it brings in the voices of not just the researcher, but the people that the research impacts the most. So when you include Indigenous people in health research and you give them a voice and a seat at the table, that's how you can influence research to make sure that it's, culturally safe care, by having people whose lived experiences can speak to what their experience is in the healthcare system and how it can be improved.
Our research is directly embedded within hospital and community care settings so that the discoveries are really driven by what is needed by patients, and that our discoveries and new findings, new inventions are actually moved into the clinical arena to help patients to improve the quality of life and to treat the disease early.